Our next conversation will again be about the power of food for healing, wellness, and deliciousness. It is my pleasure and honor to introduce Dr. Mark Hyman, a physician, a New York Times bestselling author, and the co-founder and chief medical officer at Function Health. Big round of applause. Bigger. Nice to see you. While Mark and I get to chat, we're going to be passing out a Sprouts Blue and Blue Watermelon Project charred tomato and roasted vegetable crostini fruit bowl. So enjoy that. It's been a minute. It's so nice to see you.
Yeah, good to see you too.
I'm so glad you're here. I'm wondering, and I've been dying to ask you this for months, what do you think about the growing food as medicine movement and all of the sort of energy behind it? Are you like, finally, or are you really happy?
Yeah, well, that's a funny question because I remember years ago, probably, gosh, it was maybe 25 years ago, I was the medical director at a place called Canyon Ranch, which was a health resort, and I wanted to change the menu to imbue food as medicine principles into the menu. And we had a meeting with all the chefs, all the doctors, and all the owners, all the nutritionists, and I got up and I said this, and one of the chefs got up and says, "This is not a fucking hospital." So I think we've come a long way from that. And I am very excited. I think, you know, we have been working in Washington after I wrote my book Food Fix, then on my nonprofit, the Food Fix campaign, which does both education and advocacy, and have created a lot of initiatives. We got a prevention and wellness caucus in Congress. We're working closely with Vernon Buchanan, who's the head of all Medicare and the health subcommittee. And we have a lot of food as medicine initiatives like medically tailored meals, which are now being put forward in bills. We now have it in the military. So I see great progress, great awareness, great interest, and it's sort of kind of flipped a little bit, the script a little bit, because before this was a Democratic issue, now it's a Republican issue, and I don't really care because I don't think health is red or blue or purple. It's just a human problem. So that's where I come from. I'm really focused on how do we leverage this moment where America's woken up to the fact that, God, we're not so healthy and we better do something about it. And part of the solution, a big part of the solution, is fixing our food system from field to fork.
Mark, you're somebody who goes to the Hill a lot. You have a lot of relationships with a lot of different lawmakers. How do you make these connections for them so they see that it's a nonpartisan issue, that it's an issue for all of us? Do they get it? Do they understand?
I mean, it's not hard. I mean, the data is there, right? 75% of Americans are overweight, 93% are metabolic and healthy. We're 48th in life expectancy, and we spend twice as much as anybody else. We have 40% of our entire entire healthcare budget, which is almost $5 trillion, being now paid for by the government. It's 1 in 3 tax dollars. I mean, it's just become untenable, and I think there's this growing awareness within Congress. And when we started, to be honest, it was a very low awareness level, like the awareness among members of Congress and Senate about these issues, except for a few key people like Shelley Pingree, who's here, and people like Cory Booker and McGovern from Massachusetts. There's a few people who are really pushing this forward, but it wasn't kind of a widespread consciousness shift, and I think there's been this big consciousness shift with the MAHA movement, for better or worse, and I think it's this crack in the edifice of food and food systems where we're starting to see something really shift. Like right now, I would not have ever believed it. There's in West Virginia, which is the most overweight state in the nation, the governor is going to probably sign the bill in the next day or two, a bill that kind of bans all food dyes, which is pretty amazing, and it'll be historic. And then I think it's just a domino effect. And I see this. I mean, Utah just passed a bill, whether it'll be able to implement or not, to get rid of SNAP for soda. It's like you can't buy alcohol or cigarettes or other things. So I think there's bills in 20, 30 states that are now in process that are MAHA basically bills in one way or another, whether it's creating food as medicine programs, whether it's getting the chemicals out of our food, or whether it's supporting physical education in school. That was a bill passed in the Senate. I testified a couple of weeks ago, and there was a bill that just passed yesterday called SB 25 or Senate Bill 25 that was designed to create an advisory task force on chronic disease to get all the chemicals out of school foods, get PE back in school, not a punishment if you can't go to recess or PE if you're bad, which is dumb because that's what the kids need more of. And that is going to mandate that doctors in Texas learn about nutrition, which I don't know how they're going to implement that, but I mean, That was
hope
amazing.
that
So, yeah.
I'm wondering, from your perspective, how much influence going through the pandemic had on this growing MAHA, Make America Healthy Again movement.
Great question. I think what happened during COVID was there was a big crisis in the public trust around science and medicine. And we were told things that turned out to be not true. We were told to trust the government's advice and the scientists' advice. And even those same scientists like Anthony Fauci kind of admitted, gee, the whole mask thing and the 6-foot thing was all, we were just making that up, And the vaccines were another issue where it was probably the most studied randomized controlled trial vaccine we've ever had. But they said it's safe and it's effective, period. And you couldn't question that. And like any drug or any medical intervention, even getting your blood drawn, there's a risk of infection or risk of bleeding or risk of something. And so to say it's perfectly safe and totally effective it kind of didn't give credit to the American public to understand the nuances of who it would be best for and what it meant. And we know, for example, that it has no ability to prevent the disease, but it prevents the severity of the infection. So it doesn't, like measles, if you get a measles vaccine, you're never going to get measles. But COVID, you have to keep getting it and getting it, and they never told us that. And then that kind of created a big, like, what's going on? And then we had, the issue of not only efficacy, but safety. There's a lot of consequences now we're learning about people who got the vaccine and post-vaccine syndrome and post-COVID syndrome. So it sort of shook America up a little bit and started to question the establishment and to question the influence, as Bobby Kennedy calls it, the corporate kleptocracy, which is or corporate capture of our agencies and government by industry. And I see it. I mean, it's so obvious. I was privy to some inside information from a big food lobby group. And they're basically creating a war plan, and they're going to have meetings with Secretary Kennedy, and they're going to try to pull up one over on him. But I think it's not going to work, and I think they're starting to realize that their gig is up, and they have to start changing.
Do you really think they think that their gig is up? That these
Yeah,
lobbyists with all
I
this
do.
power?
I mean, there was an article in the New York Times. I think the Consumer Brands Association met with Bobby Kennedy on Monday of this week, and immediately issued a letter that was intercepted somehow by the New York Times to all the members, like, the big food companies were members of this association, and basically said, kind of gigs up, change is imminent, get ready. Like, we're kind of on our heels a little bit. And, they go in with their talking points and their fake science and their fake grassroots lobbying and their co-opting of science and grassroots groups and academic institutions and front groups. And they have a whole kind of war plan on how they do this, which I outline in my book, Food Fix. But it's, I think it may not work this time. I think, Brooke Rollins is still trying to get her feet on the ground, who's the Secretary of Ag. But I think her and Robert F. Kennedy Jr. are actually working together, which is extraordinary. I mean, I think the USDA causes us to be sick, and the HHS, or the Health and Human Services Department, kind of cleans up the mess with Medicare, Medicaid, and all their health programs. So there's got to be an alliance, and I see that happening. I know they're meeting. I know there's this conversation's happening. So it remains to be seen. It's a moment that's fraught with danger, but full of possibility. So let's see what happens.
Yeah, we'll see what happens. You mentioned the need for nuance before, and you have written extensively about healthy eating and its link to increasing not only our lifespans, but also our health spans. Can you sort of explain what the difference is between those terms?
Yeah, I mean, it's pretty intuitive. Your health span is how many years you're healthy, and your lifespan is how many years you're alive. And for the average American, the last 20% of their life is not healthy. So they only have 80% of their life having health span, and 20% not. And that means, you're not functional, you can't do what you want, you can't engage in your social activities, your family activities, work activities, things that give meaning to life and purpose, you're kind of cut out. And so we want to kind of close that gap. There's something called compression to morbidity, which means you basically kind of live healthy and then just die, right? You've all heard the stories of, my 100-year-old grandpa was like having dinner with us and had a nice time, said goodbye, he's heading out to bed, and he fell asleep, and that was the end. And the same day he was walking 5 miles. So you hear those stories. That's when your health span and lifespan are just about the same. You don't spend the last decade or more of your life in poor health. I mean, 5% of the Medicare population accounts for 50% of the cost of Medicare, which is over $500 billion. Mm-hmm. And that's something that can be addressed through food as medicine. And we're seeing this now with food as medicine programs. There are pilots and studies that show that you can by providing medically tailored meals, meaning if you're a diabetic or heart failure patient or a kidney patient or you have something serious, we can provide the food for you, and it's not only going to be helping you health-wise, but it's going to save up to $12,000 per patient. This was just a study from Cleveland Clinic. There's a lot of that kind of data, which to me is very encouraging, and hopefully be able to be used by the Secretary to actually move forward with Dr. Oz and change some of the Medicare policies around reimbursement. Because right now there's no reimbursement. And I think one of the things we're working on is actually trying to get nutrition as a paid-for service within healthcare. Right now it's not, unless you're diabetic or have kidney failure. And it's basically, if food is medicine, it is a drug. And I think I should maybe define what food is medicine is, because I'm not sure if people really get it. It sounds like, oh, it's great, food is good, it makes you healthy and so forth, or it can make you sick, we get it, it's the biggest poison, it's the biggest healer. But what does that actually mean? Well, food is basically molecules, and those molecules modify your biology in real time. They change gene expression, they change your epigenome, they modify hormones, they regulate inflammation, your immune system, they change your gut microbiome, they change your brain chemistry, literally with every single bite. And so depending on what, just like general pharmacology, which is, you're not giving him one drug for every disease. There's not one food or diet or approach to every problem. If you have an autoimmune disease, it's maybe one approach. If you have diabetes, maybe another approach. If you have kidney failure, it's another approach. If you have, depression, it might be another approach, or bipolar disease or schizophrenia. So there's a remarkable nuance and actually specificity, just like, with drugs. There's the dose, the drug, the dose, the frequency, the duration. It's exactly like that. And we can literally reverse most chronic diseases that are thought to be irreversible, like diabetes or heart failure or autoimmune diseases or other chronic issues like chronic mental health issues, by using food as medicine. And it's not like a theory. This is well backed up by research.
Sure. Mark, when we're talking about sort of personalizing medicine and using food as medicine in the way that you've just described, what kind of logistics are necessary? What kind of infrastructure is necessary to put this into practice in a wide-scale way?
You mean delivering medically tailored meals, or just the framework of food as medicine?
I think all of it. Medically tailored meals are certainly one part of it, but looking at, the way doctors interact with patients now, there's some change needed there, right? That it's not just prescribing drugs, it's prescribing food.
I mean, that's going to take a minute, and I think there's some big levers to pull around how we shift healthcare to be more focused on nutrition. One is something that I proposed to Bobby Kennedy, which is to ask all medical schools that receive federal funding to provide evidence of their nutrition curriculum. And according to the National Academy of Sciences, you should have you should have at least 10% of your curriculum be nutrition. And I think only 20% of schools meet that. And of the nutrition they use is not probably the right nutrition, like what I learned in medical school. And so that then could lead to a rule where if you're a federally funded academic center for either research or other avenues, that your funding is dependent upon you having a certain percent of your curriculum being nutrition focused. And then you could also reimburse for nutrition services within healthcare. That's one of the things we're working on with policy. And there's some great allies: Senator Cassidy, Senator Booker, Senator Marshall. These are. Booker's not a doctor, but Cassidy and Marshall are both doctors, and they understand these issues, and they're really leaning into the right efforts on this. So, I think there's a lot of interest in this. I think that could be a huge thing, because right now, my daughter's graduating in a month from medical school, and she had zero nutrition, zero education about insulin resistance, about microbiome, about environmental toxins, or more the things that really cause people to be sick. And so if you put on the exam a certain number of questions, then the curriculum has to change. So ultimately it comes down to licensing exams, and there's also $17 billion that the graduate medical schools get. Like if you're in residency, there's $17 billion that go out from the federal government. We're working on making that not a no strings attached, here's the money, do what you want. But if you're getting this money, here's your accountabilities for providing the basic nutrition education to your residents, particularly in specialties where it matters. If you're really, any specialty matters, but like if you're a surgeon, it may matter less, but in the immediate term, although I think it matters a lot how healthy you are when you go into surgery and what happens after surgery. So it should be a mandatory part of medical school, and I think that's coming.
Yeah, and that movement has been growing, and your daughter learned a lot from you. She didn't need that education, but so many medical students are...
She never listened. One time, I wrote a book called The 10-Day Detox Diet, And it was all about, how to improve your metabolism and lose weight. And I walk into her bedroom, and she's like a teenager. She's reading the South Beach Diet. I'm like, what are you doing? So.
Good parenting, Mark. But what I'm trying to describe is, like, I personally know of a lot of medical students and medical students who are part of nonprofits who are craving this information, for lack of a better word, hunger for it. And they're teaching themselves, they're learning from nonprofits. What advice would you give your daughter, and others like her before they enter medical school to learn more about these things?
I think, the Institute for Functional Medicine is a nonprofit educational institute, and I'm on the board. I've been the chairman, and I've been involved for over 20 years. And it's got a wonderful nutrition curriculum that could be just the most basic foundational curriculum for people who are in medical school, who are thinking of going to medical school. You have to get some basic foundational understanding of nutrition in the human body, and they're not providing it. So they need to kind of be self-taught, and I think there are resources out there. There's other curriculums out there. I think the American College of Lifestyle Medicine might have one. So there's a lot of things that they can draw from, but it's really essential that if you're going into it, you should. Now, my daughter, no matter what I said, she would not read the books I suggested. She would not listen to me. I said, I'm not paying for tuition. Of course, then she got a full tuition scholarship, so I didn't have that lever. She didn't read this book, so, what are you going to do?
The self-teaching aspect is not only good for medical students, right? It's good for people in this audience. And you've written so extensively on these issues. Is there particular advice you want folks to take away from this discussion about, how they can get started? If they haven't really understood food as medicine or medically tailored meals or some of the things that are now becoming popular because of the MAHA movement, what advice do you give them?
I'll read my book, Food, What the Heck Should I Eat? And then there's a shorter version called The Pegan Diet, 21 Principles for the Nutritionally Confused. So either of those really lays out, from a scientific perspective, what we know about nutrition and what we agree on and what the foundational principles are. And I just was on the Diary of a CEO podcast with Christopher Gardner, who's a Stanford professor who runs the Plant-Based Medicine Institute. And so we had a very vigorous discussion about the merits of different ways of eating, but at the disagreements were around the margins. Like he's a vegan, I'm not. I think there's a role for animal protein, and the quality matters, and how it's grown matters, and not contributing to the destruction of the earth through industrial CAFO farming, of course. But we agree on that. But it was amazing to see the amount of agreement that there was, and that the consensus: we should be eating real food, we should not be eating ultra-processed food, we should be eating lots of fruits and vegetables, we should be eating lots of good fats, we should have adequate amounts of good quality protein, and we shouldn't be eating refined starches and sugars. I mean, it's not complicated. It's really not complicated. I used to do a program called the Danielle Plan at this church in California, and we had, I gave a lot of talks, and I would give these talks, and I was like, wow, if you believe God lives in you, why are you feeding him crap? And then we ended up having this Danielle Plan that 15,000 people signed up for. They lost 250,000 pounds in a year. They did it together in small groups, which I think is a really powerful way to change. We find that small group learning and small group support. It's AA, it's Weight Watchers. And so I used to say it's really simple to figure out what to eat. Ask yourself a simple question. Did God make this, or did man make this? Did God make a Twinkie? No. Did he make an avocado? Yes. Even a 3-year-old can understand that, right? What are Doritos? Is this something that you can pick off a bush or a tree or grow in the earth? No. So it's not that hard if you really just simplify it. And we actually wrote a book called The Danielle Plan. It did very well. And we won the Christian Book of the Year award. I'm the only Jude, I think, ever win that. Well, there was that other guy about 2,000 years ago, but
Oh boy. Okay. I want to push back. I want to push back a little, because I feel like from consumers, the eaters I hear from, they're confused about what to eat. And your friend, Dr. Dari Mazafarian, will be here today to talk about how he and others...
Tomorrow.
Yeah, tomorrow.
Tomorrow I'll be.
Yeah, are trying to sort of unpack that confusion and make the information that people are finding on the internet, whether it's, your blogs or books or whatever, just sort of more, again, lack of a better word, digestible, and have the information that's really valuable be at the top.
Yeah, it's really challenging because, as I mentioned, the food industry is very focused, very organized, very strategic, and has infiltrated every aspect of our society, from the media to academic institutions to professional societies like the American Heart Association to social groups. Like, I went through the list. And the problem is that they don't want us to know what's good and what's not good. And 40% of nutritionists who are on Instagram are paid by the food industry to promulgate misinformation, to confuse people and get people to misbehave with their food, to eat their junk. And that was an expose in the Washington Post last year. So that's just one example of the level that they go to confound and confuse people. And I'm having to work with politicians who are like hearing the lobbying talking points. Oh, this food won't be safe. It's not going to be affordable. It won't be convenient. Discriminating against the poor. They have all these really noble talking points, but you dig a little bit below the surface and you realize that this is just their strategy to prevent any substantive policy change. And I think the people who are now going to be in place, whether it's Dr. Oz or Dr. Macri or Bobby or Jay Bhattacharya at the NIH, there's a really solid group of thoughtful, independent scientists and doctors and policy folks who really want to make a shift, and they're not fooling around. And the food industry's sweating in their corner. They're going to try to fight back hard, and I think what everybody in this room can do is kind of help keep the pressure on Washington and on your state capitals to do the right thing, to make sure that this movement doesn't kind of die down. Whether you're Republican or Democrat, doesn't matter. Like, everybody gets sick, everybody's affected by food. The changes that have to happen regardless of what your political beliefs are. So it's not a partisan issue. It can be made one easily, but it's not. And I think just being out there and pushing your legislators to do the right thing is a big deal. And actually sharing content on social media and using your platforms and talking about it and talking to your friends. I mean, having dinners to talk about this. How can you help and participate? Like, we had a dinner at our house with a bunch of local folks who are influential about how do we focus on amplifying this movement to create health in America. And then we had a meeting with a bunch of senators to, in our house, to have a dinner to talk about how we support them to do the change they want. So it's not like one little thing. It's got to be just like an army of us out there day after day. And it gets tiring, but I think it's really important because this moment. We have like 4 years or maybe 2 years. I don't know how it goes, but this is that moment when things could shift. Just like, and we've seen this before. We saw segregation, and then boom, it was over. We had civil rights, or we had. I mean, it wasn't exactly over, but at least legally it was over. And we have women's rights, gay marriage. I mean, these things were not things that were acceptable, and then they happened. And it's kind of odd. We had Johnson, who was a pretty big bigot in the civil rights bill. We had Reagan, who was basically the most staunch anti-communist in the Cold War. And then maybe the McDonald's eating, soda drinking president will help fix the food system. Who knows?
I think that's a good point to end on. Thank you so much for being here, Dr.
My
Hyman.
pleasure,
Always a
Danny.
pleasure to talk to you.
Thank you
so much. Thanks.